அனைவருக்கும் வணக்கம். நமஸ்காரக. Myself, Dr. Arul Amutan, working as a faculty in Manipal Academy of Higher Education, Karnataka. I thank Jignasa for giving this opportunity to talk with you. I welcome you all for the brief talk on integrative management of Putru, that is cancer, using Siddha. Siddha is an independent traditional medical system evolved in southern part of India and Sri Lanka, developed and founded by the Siddhas. Who are those Siddhas? Those who practiced yoga to acquire higher supernatural power of Ashtanga Siddhi and attained godness are called Siddhas. They are the ancient days Indian medical scientists. Siddhar Agasthyar, also known as Agastya Muni, one among such a Siddhar, is considered as the father of Siddha medicine. Siddhar Tirumular, one of the Siddhar, says, Ullam Perungoyil, Unudambu Alayam, which means the human body is the temple where the God resides. This is known as Siddhantam or Siddha philosophy that differs from others' philosophy. He also states that Udambine Yanirந்து Ombuhindin. The last line says Udambine Yanirந்து Ombuhindin, which means once he realized the truth of body is the temple, he looked the way to preserve it. So based on this vision, Siddhas developed Siddha medicine. When we talk about Siddha for cancer, the next question would be, what is the terminology for cancer in Siddha? What Siddha knows about cancer? Well, the question is reasonable. Let me throw a light on this. Siddhas classified the diseases into 4,448. They described the clinical features of each diseases and also mentioned the specific drugs to be used for each disease. Among all the traditional systems, we can see such a detailed classification and specific therapy only in Siddha. This is the uniqueness of Siddha. Look at this picture. There are elevations above the ground level. Many are there at distant places. Even if you destroy, it would grow again. Through the underground tunnel, they spread to a distant place to build another mount, irrespective of external temperature, rain or high sunlight temperature. Termite nest inside maintains the microenvironment for its survival. This is known as Putru in Tamil. Siddhas had a deeper understanding on these characteristic features of cancer, such as abnormal growth and metastasis, and named this disease as Putru, which means the disease of growth like termite mound. Today we use the term cancer for this condition. Individual cancers are named with the organ involved. For example, Kanna Puttu means buccal cancer. Kanna means buccal. Naka Puttu means tongue cancer. Similarly, Yoni Puttu, carcinoma cervix, Anda Puttu, testis cancer, Marbaga Puttu, breast cancer, and many more are described in Siddhas. This is how the nomenclature was given in Siddha literature. There are many terminologies used to describe the abnormal growth. For example, Kalalai mean movable mass, Katti mean immovable mass, Mullai or Ani mean a horn-like growth on the skin. Parangi, Sangi, Singi, Girandi are the terms used to denote the irregular small growths. Vipurdi, Katti, Vipurdi is the term used to describe the irregular medium-sized abnormal growth, sometimes associated with ulcers. Arayapukatti, Todaivalai, Kandamalai are the three terms used to denote the lymph node-related neoplasias. Mostly these are not a benign, not a malignant type. The term Putru means definitely the malignant type of tumors. What are the literatures available on the cancer in Siddha? So there are many literatures like Kirandi Nidhanam, Kalale Nidhanam, Pilave Nidhanam. One literature called Marbaga Maruthvam, which talks about 8 diseases of breast. Only breast disease is described in this Marbaga Maruthvam. That includes Marbaga Putru, the breast cancer and its metastasis. types. Putru Nidhanam is an exclusive literature for malignant cancers that describes 18 different types of cancers occurs in oral cavity, respiratory system, breast, genitals, and internal organs such as liver, lung, colon, and brains. Coming to the Siddha cancer therapeutics, there is a Siddha proverb, where paru, thalai paru, minjinakal, mella mella parpa senduram paru. It means treat with the roots and shoots. If not responding, gradually start with the parpam and senduram, etc. Accordingly, we use metallic preparation mostly in the cancer to destroy the cancer. When we talk about metallic preparation, I would like to give one point here. You are familiar with parpam and sindura as a basma and sindura. If these two are not effective, what is next? Yes, Siddha has 10 unique metallic preparations. Apart from parpam and sindura, we have 8 more higher versions like chunnam, karupu, padangam, kattu, kalangu, chattu, urukku, kurugulige. So these are the higher versions of the metallic preparation. So we categorize the Siddha cancer treatment therapies or drugs into 4 categories. Category 1 is actually Siddha chemotherapy. They are mostly metal-based preparations. Category 2 is a herbomineral preparation. They have broad spectrum activity. Category 3 is the supportive or adjuvants. Category 4 is a group of drugs or herbs used to reduce the adverse effect caused by the Siddha metallic therapies or Siddha chemotherapy. Category 1 is the metallic preparation used in the cancer. I told you already there are 10 different type of formulations available in the metallic preparation. So they are the actual anti-cancer agents used in the Siddha. They kill the cancer cells and also normal cells. Usually these drugs are made by the combination of arsenic, mercury, sulfur, gold, silver, zinc, copper, lead, and tin. They are administered usually orally. Some are inhalationally available. When the patient is not able to consume orally, we prefer the inhalational smoke, medicated smoke type of drugs. Few examples are like Puttu Padangam, Chandamarda Chanduram, Tamrakattu Chanduram, Navapashana Chanduram, Navapashana Thailam, Sudar Thailam, Guru Padangam, Vali Rasa Chanduram, Rasa Padangam, and the list is very big. These drugs are usually administered 3 days or 7 days or 10 days or 14 days. The duration is decided by the Siddha physician based on the severity of the disease and the patient tolerability. After 3 or 10 or 14 days of drug therapy, there must be a drug holiday or drug-free period for some more days. Then again the drug is administered for the 3 or 7 or 10 days. So this is how the category 1 Siddha chemotherapy drugs are given as a cyclical therapy. This cyclical therapy will be helping for the normal cells to replenish back. So there must be a strict dietary practices, dietary strict pathyam are there during these treatments, which helps the drug to act more on cancer cells and also reverse back the toxicity in the normal cell. Coming to the category 2 drugs. These drugs are usually herbomineral drugs or having broad spectrum anti-cancer activities, and also they will have immunomodulatory activities, anti-metastasis activity, and many other activities. So these drugs can be given continuously for many months without any side effect. Few examples are like Rasagandhi Melagu, Idi Velladi Melagu, Nandi Melagu, Neeradi Muthu Valladi Melagu, Chitramoola Kuligi are the few examples belong to this category. Coming to the class 3 drugs, they are actually supplements. For example, Amla, Nellikai, Bilwadi Legium, Amukura is nothing but the Ashwagandha, turmeric, these are the supplements, nutrition supplements. This belongs to category 3. Even Varman therapy and Kayakalpa therapy are also belong to this category 3, class 3 category. So here, Kayakalpam includes yoga therapy. So yoga also belong to class 3 or the supplement variety. Siddhas are the yogis. Being the owner of yoga, Siddhas has given more importance for the yoga therapy. So this category drug or therapy have a major role to play in the palliative care in the cancer patients. Coming to the class 4 drugs, these are a group of herbals they be used to reduce the side effects produced by the Siddha metal-based chemotherapy or the class 1 drugs. For example, when we use Chandam or the Chanduram for a particular period, the patient may get oral mucositis. So to reduce that, we have to use Arugan Kattai Kudinir or Nechiti Kashaya. Similarly, for each metals, there are specific herbs we use to reduce the side effects. If the bone marrow suppression is there, then we have to use Manduram based drugs, Mandura Kudinir, etc. Nowadays, these herbs we are using even to reduce the side effects of radiotherapy or allopathy drugs, chemotherapy induced side effects, which is a type of integrative approach. Before we start any Siddha treatment in the cancer patient, we should prepare the patient. How to prepare the patient? We have to use Siddha the Ennai or Rasaka or Agasthyar Kulambu, any of the one for 1 to 3 days with a suitable Anubanam. This is aimed to balance the Vadam, Pittam, Kabam or the 3 doshas in its own ratio of 1/4 ratio. Depending upon the deviated or abnormal dosha, there may be a vomiting, diarrhea or sweating or either or all the 3. So anything can happen. So we are not compelling to induce the vomiting. We are not compelling to induce diarrhea or purgation. So the body will choose the way to excrete based on the abnormal doshas. So this is the simplified Siddha Panchakarma. Within 3 days, 1 day to 2 day or 3 day, we can give a lot of benefit to our patient. This is aimed to restore the physiological status of the body organs, to reset the gut microbiota, to reset the healing pathways, and also to sensitize the receptors and enzymes involved in the healing process. So once we prepare the patient first, then we have to give the category 1 Siddha chemotherapy drugs. If any side effect occurs, then immediately we have to use category 4 drugs to reduce the side effect. Once cancer is controlled by using the cyclic treatment, cyclic therapy of category 1 drug, then category 2 and 3 drugs, other herbomineral 2 or supplements can be used for the rest of the periods for the maintenance period. How do we practice integrative Siddha Putru? In early diagnostic cases or in old age patients where they are contraindicated to undergo surgery, chemotherapy or radiation, Siddha drugs can be straight away started immediately. Suppose in all the other cases, we recommend to undergo surgery or radiotherapy or chemotherapy based on the oncologist opinion. After that, we start the Siddha treatment. This integrative approach is more helpful in advanced cases or resistant cases or even in the metastasis cancer. Siddha herbs are also used to reduce the adverse effect or side effects induced by the conventional radiation or chemotherapy. So that is also integration possible. Siddha drugs do not produce serious side effects, and also they are very cost effective. Approximately 1,000 to maximum 5,000 rupees will be the expenses for these Siddha anti-cancer drugs based on the drugs we use. So it is definitely a cost-effective treatment. With this brief introduction, I would like to conclude that Siddha has a deeper understanding about the cancers, either alone or in combination with the other medicines or radiation or even with other Ayush systems. Definitely, Siddha could be used to manage the cancers effectively. So, thank you very much for watching my talk. Nandi, Vanakkam, Dhanyavadaha.